Hello, EXS486 and Dr. Reed. Real quickly, my name is Sam Nardi, and today I'll be giving you a presentation on cerebrovascular accidents, which are more commonly known as stroke. And what I would like to do is give a quick overview on the basics of what a stroke is, the causality and effects that a stroke has on a person, and last but not least, the treatment methods, most specifically how exercise and physical activity can assist in the prevention and treatment of strokes. So let's start really simple and answer the question, what is a stroke? A stroke, according to the American Association of Neurological Surgeons, is an interruption of blood flow from the heart to the brain. And this can be caused by a blockage in our artery or bleeding in our brain. So let's take a deeper look and see what causes a stroke. A stroke is technically a form of cardiovascular disease characterized by the buildup of plaque. So basically what's going on here is our blood is transporting fats, cholesterol, all these different nutrients all over our body. And as it flows, some of these fats and cholesterols begin to attach to the inside of our arterial walls. And this is known as atherosclerosis. Over time, it begins to thicken and build up, which really causes a narrowing in our arteries and restricts the blood flow to our different organs, and specifically in this case, our brain, which is one of our most important organs. So if you look at the image on the top, this first artery, there's no restriction, and this person would be considered a healthy individual with no risk of stroke. If we look down below a little bit, we see, a little bit of plaque beginning to build up there. So this person may be at risk for a stroke and would probably want to seek some medical attention. But now that we know just the basics of what atherosclerosis is, this narrowing of our arteries, let's look at what arteries it actually affects. And those arteries affected during a stroke are the cerebrovascular arteries. But that's a pretty big word, so let's break it down really quickly. Cerebro means our brain, and vascular means blood flow. So you put that together and it's blood flow to our brain. What we have to remember is that arteries are always pumping oxygen-rich blood from our heart to our brain in this case. And the brain needs this oxygen-rich blood in order to maintain proper functioning. And when this is restricted by the atherosclerosis, these brain cells don't receive the oxygen that they need to function. So look at this picture right here real quick. Gives you a little bit more detail. You can pause it if you want to get some more detail about where these different arteries are going and what part of the brains it's affecting. But we're going to move on, and I really want to point out that when these arteries are cut off, oxygen does not reach our brain, and our brain cells are very interesting. They have this characteristic which they are not regenerative, which means that they are not able to reproduce or repair themselves after they've been damaged. So it's especially important that when someone is suffering a stroke, you want to treat that person as quickly as possible in order to prevent the spreading of these brain cells dying, because they have such great effects. The physical and cognitive and mental disabilities that come along with it are really serious. So let's look at what actually is putting us at greater risk for a stroke. And the first list here is unmodifiable risk factors, which means that these things cannot be changed or controlled. They're out of our control. The first is age. This is especially prevalent in our older population. As we see, our risk doubles after the age of 55. Family history is also an important determinant, because if you've had a family member who suffered a stroke or suffers from some sort of cardiovascular disease, then you may be at a higher risk. African Americans are also at a higher risk than white people. Gender is also a big determinant, and previous stroke. If you suffered a stroke before, you may be at a greater risk of suffering a stroke. This next list is what gets me really excited, and the reason is these are modifiable, changeable risk factors. And I look at this list, and 5 of the 7, hypertension, diabetes, high cholesterol, atrial fibrillation, physical inactivity, these are things that can be very easily changed with exercise. Yes, they're going to be changed and prevented with different medicines and pharmacological tools that we have, but exercise is a huge part of reducing our risk for these things. And if we can reduce our risk for them, we can reduce our risk for suffering a stroke. And so if we look also, diet and smoking, if you exercise often, then you are not going to be smoking, and you're going to be eating well. These are lifestyle changes that can be made easily in the addition to exercise, and can save you a huge headache pun intended. These are some of the symptoms of stroke, and headache is a major one. Dizziness, nausea, and vomiting along with it. I'm not going to read them all to you, but you can take a look at this list and we'll see exactly what is going on in a person when a stroke is occurring. So let's take a look at some of the effects that come along with having a stroke and that people experience in the aftermath of a stroke. The first is hemiparesis, which is weakness on one side of the body. The next is hemiplegia, which is paralysis on one side of the body, spasticity of muscles. All these three lead to reduced ability to perform different activities of daily life, which can be taking out the trash, getting your kids ready. Very simple things that you need to be able to do. You may not be able to do as well as before your stroke. And they also can lead to a sedentary lifestyle, which puts you at a greater risk for these secondary cardiovascular diseases and all of these very important things, which then in turn puts you at risk to suffer another stroke. You also suffer many different cognitive and memory deficits. You may not remember everything after a stroke. Aphasia is another very important effect that people suffer from after a stroke, and it's the difficulty of forming words or speaking, and your speech is very hard to understand, which can be a barrier between yourself and your exercise specialist. Let's take a look at the two types of strokes, both which can be further broken down into two subtypes of stroke. And the first one is ischemic stroke, and this accounts for 80% of all strokes. And what is basically characterizing an ischemic stroke is that a blood clot is formed or something is blocking the artery. In a thrombic ischemic stroke, there is a blood clot which is called a thrombus, which prevents blood flow. Embolic, there's a piece of plaque or thrombus that becomes dislodged from its original position and blocks further downstream. Usually it doesn't block the entire artery, but it does restrict blood flow. The next one we see here is a hemorrhagic stroke, which is far less common but no less serious. It is also broken down into two types of stroke: intercerebral, which is bleeding directly into the brain tissue, and intracranial, which is bleeding which fills the cerebrospinal fluid space. Both are very serious and need to be treated immediately. So let's take a second to meet our client George, and you can take a second to pause this and read the entire case study, but I'm going to give you a rundown of the important things that we're going to need to know. George is 57 years old, he's white, he's been a smoker for most of his life. Mother died of cancer at age 64, brother suffered a heart attack at age 70. He's got a blood pressure of 145/90 and a BMI of 31. He stays active playing golf and tennis and eats a well-balanced diet because his wife is a chef, although he does consider himself to be a heavy drinker. He suffered an ischemic stroke 3 months prior and suffers from the following effects: hemiparesis of the left side, spasticity in his muscles, reduced activity, and slight memory deficits. And he does suffer from aphasia, so he is somewhat hard to understand at times. His goal is really that he wants to get back to playing golf again, but he understands that it's going to take time. So let's take a look into George's coronary risk factors here, and I've listed all the risk factors and we can take a look at them, but I laid it out all here for you. And this is George's risk stratification. He's negative for family history because his mother's had cancer, which does not qualify as a risk factor, and his brother is over the age of 55. He's a positive for smoking, obesity, and hypertension, but dyslipidemia and prediabetes, the information wasn't there. He has begun to live a sedentary lifestyle in the past 3 months, but prior to that he was physically active, and we know his goals. But this would classify George as high risk, not because of his age, not because of his risk factors, but because George has suffered a stroke, which is a cardiovascular disease. This means that, yes, we need to get all of the physical or medical requirements, and a physician is always going to be required at all of these testings. Okay, so now that we have George's risk stratification, we're going to move on to the exercise testing, and we're going to need the physician's presence during this exercise testing because George is such high risk. We're also going to just be informing George on a few things to get him prepared and comfortable for the examination testing, so that there's no anxiety. We want to reduce his anxiety to ensure that we get the proper test results. We're also going to have him fill out the necessary forms, such as the PAR-Q, informed consent, to ensure that we are covered, as well as that George's safety is at the highest level I think that it could be. So get him comfortable. The next thing we're going to want to do is do a quick pre-exercise screening for a few things, and the first one is blood pressure, because hypertension is a major risk factor for hemorrhagic stroke. Also, we're going to want to check that he has no additional symptoms of coronary artery disease, because this could be a risk factor for ischemic stroke. We see that George has been going to physical therapy for about 3 months now, and his functional capacity and things for daily life has improved a lot. He's also taking Ramparil, which is an angiotensin converting enzyme inhibitor, which this could cause a decrease in George's resting and exercise blood pressure. So real quick, I just want to go over FAST. FAST is an acronym published by the Strength and Conditioning Journal, and it's to tell how your client is experiencing a stroke, or if they're experiencing a stroke, which is incredibly important when exercising a client or testing a client that has suffered a stroke. And first, F is to determine if one side of their face is drooping down when they're trying to smile. The next is if their one arm does not raise up when they try to lift both arms. If their speech is slurred, and you just want to record what time these symptoms happen at and occur at. So we're going to do a mode of exercise testing on a treadmill, and the protocol will be a self-selected speed by the patient, George, in order to reduce anxiety and boost his confidence, knowing that he's not under any pressure to perform. We're going to do a 2% increase in grade every 2 minutes, and begin at 20 watts and increase to 10 watts per minute. We're going to measure ECG, heart rate reserve, and ventilation. And from this test, we may detect myocardial ischemia. So let's check out George's results real quick. George's ECG returned negative for myocardial ischemia, and the test was terminated after a duration of 10 minutes due to shortness of breath and patient requesting to stop. So we see that the client's goals are to return to playing golf, and to achieve this, we must improve his strength and capacity for exercise and physical activity, because he can't be going out to golf and not be able to play a full 18 holes. So let's take a look at this exercise prescription that I've written up, and I got help from a strength and conditioning article on exercise prescription. And we're going to do 3 to 5 days per week of 30 minutes, and they can be in 3 bouts of 10, but we'd really like to see George at least achieve 30 minutes of continuous exercise by the time that we're complete his program in the maintenance phase. We're going to go to 40 to 70% heart rate reserve, or 55 to 80% heart rate max, or an 11 to 14 on the Bohr scale of 20. We really want to work these large muscle groups in order for maximum improvements in George's exercise capacity. And we're going to do a combination of weight and non-weight bearing exercises. Next, we're going to go to resistance training. We're going to do this 2 to 3 times per week, but we have to make sure that we have at least 48 hours of rest between bouts when we're going to be exercising the same muscle groups. We're going to do 8 to 10 muscle groups, working the major muscles, and with a rest of 60 to 90 second rest period. 50 to 80% of 1 rep max will be more than enough, and they should be struggling when they get into those last 3 reps. We really want to make sure they're working hard, but we're not pushing them too hard and causing them injury. Body weight exercises, machines, resistance bands, free weights. Pick the mode that is best for your client, but for George, we're probably going to go with some machines just to ensure that he gets a safe start to his exercise. We may progress to free weights though. We're also going to do some flexibility training. Flexibility is incredibly important in golf, and we're going to do that about 3 to 5 days per week, 10 to 20 minutes, but we're only going to do PNF stretching for now. We may progress into static stretching on George's and once his balance and everything is a little bit better. But we're going to start with PNF for now. And we're going to do this below the point of discomfort. So just to the point where George is feeling a stretch, but not too much. And in conclusion, I just want to say I put a link here if you want to find out more about stroke. But if there's one thing that you really want to take from this, and it's that FAST acronym, because FAST, this will really help you to improve your ability to work with a stroke victim and identify and help them to prevent further damage to their brain by getting them attention as quickly as possible, because they really do need it so that there's not more damage to the blood vessel or to the cells in the brain. Thank you very much. Here's my references, and I hope you all enjoyed the presentation.